Agents, this is Luis Moreno with Insurance Agent Training. We just got some hot news on some of the latest CMS changes for ACA that are being pushed down towards us. I'm going to go over what some of those changes are and how they're going to affect us. So make sure you watch this entire video. Guys, before I give you all this latest info, please do me a favor, like this video. Okay, it is some good news, but we're still going to have to deal with some of the bad. Okay, comment down below. I do respond. And number 3, do me a favor. If you're not a subscriber, I sure would appreciate the support if you would subscribe. All right, so some of the latest changes that we're having to deal with. Unless you've been living under a rock, you know what's happening. And then on the 22nd, there was a court ruling that stopped some of these changes from happening. The number one change, then there's 3 of them. Number 1 is going to be this $5 premium on passive renewals. Okay, so we were told as agents that if anybody passively renewed, which means we didn't actively renew it, we didn't do a new eligibility, update this, even all the information, we didn't manually go in there and update it and get a new eligibility and enroll them. If we did not do that, they were going to consider that enrollment, that renewal, a passive renewal. And if they ended up with a $0 premium, they were just going to automatically add $5 to it. Okay, for what? Mainly what they're trying to do, and this is where the issue would have what we as agents would have to deal with is some of these people are used to paying no premium. There's no billing information. So they get this $5 and if they don't pay it, 2 or 3 months it cancels, and there's no way to get them a policy for the remainder of the year. So that was problem number 1. Well, with this court ruling, we know as of right now that has been paused. So we're not going to deal with this $5 premium on passive renewals that would have had a $0 premium. So in a way, that's a good thing. Okay. All right. So that's number 1. Number 2, the expanded pre-enrollment verification. Okay, or SEP verification, not OEP, but SEP. What they're saying here is that if we were to have an SEP, an active or a true SEP that we were going to utilize to enroll somebody into an ACA plan, the CMS changes were that 75% of those SEP documents that we submitted to verify this SEP were going to be audited by somebody. Okay, we don't know who, but they were going to be audited by somebody at healthcare.gov to make sure that that SEP was, or those documents that were being submitted to support that SEP were factual. Well, they put a stop on that. The third one is data match issues for certain incomes. Now, my guess is more for the lower income, maybe for those people that fall below the 100% and magically they're at the 100% level so they can get full subsidies, where they were going to audit those and request proof of income. They were actually going to be at that level. Well, they put a pause on that. So again, 3 things that were put a pause on. Number 1, the $5 premium on passive renewals that would have ended up with a $0 premium. Number 2, the 75% audit on the documents that were going to be submitted to support an SCP. Number 3, the DMI, data mismatch issue on incomes and at the lower level, where if their tax documents from previous year indicated that they were at this level, but now for 2026 they're magically at that level where they get 100% income, they were going to request proof of that. Not anymore. So those are the 3 things. Now you're thinking, hey, this is all good news, Luis. Where's the bad news? Well, the bad news is there's still some other changes we're going to have to deal with, and they're huge. Number 1, is the ACA cliff. That's coming back. Okay. We've always had it. And then when Biden came into office, either the Inflation Reduction Act or the American Rescue Plan, one of them, took away the cliff, which meant that when somebody got to the 400% level on that federal poverty chart, if they were $1 over, it's like they took one step beyond that cliff and they fell all the way down. And that little was they got zero subsidies. What Biden did is he took away the cliff and he made it a slow, gradual downhill. Okay, which means there was no immediate loss of subsidies. It just kept going lower and lower and lower as the income was higher and higher and higher. Okay, it was a gradual loss of subsidies, which was nice. Well, we're going to have to deal with that in 2026. It is what it is. So we got the cliff back. Number two, along with getting this ACA cliff back on subsidies, we lost the enhanced APTC. And so under that inflation or the American Rescue Plan, what happened is more people or people with when you compared the subsidy amounts that people got prior to that passing of the American Rescue Plan or the Inflation Reduction Act, whichever one of those was, people got this much help at this income level. Well, when that passed, they got more help, which literally meant a lot more people got $0 premium plans. Okay, and then also people with higher incomes got help. Well, now that EAPTC is going away, those enhanced advanced premium tax credits, that extra help is going away. Well, what we're anticipating next year is much, much higher premiums. There's a calculator out there that Kaiser Family Foundation put out, and I plugged in a family of four. I can't remember the parameters, but they're paying about $90 a premium right now. And it was very, very accurate. 2026, it estimated that that family was going to start paying a little over $300. The same plan, everything. It was just really a difference in subsidy, which means what are we going to deal with next year is less subsidies, higher premiums. The solution to this, guys, is going to be this. The solution to this is going to be you guys are going to have to become masters of cross-selling. We're going to lose a bunch of people that are just not going to be, they're not going to be willing to pay that extra premium, or they can't afford to pay the extra premium. So what's going to happen for us agents is that those policies that we're losing, we're either going to have to make up that lost income by writing more. So that's number one. Or we're going to have to cross-sell the book that we have. More dental and vision, more indemnity plans, life insurance. Okay, so in addition to all that, guys, you're also going to have some alternatives to ACA. Okay, maybe some short-term plans. I've seen some carriers now that, we still have to deal with, as of right now, the 4-month rule, the 3+1 rule for 3 months plus 1 month extension for short-term medical. Well, some carriers are stacking 3 different plans so that it lasts for the year. Okay, so there's some alternatives for short-term, but those are fully underwritten, no pre-existing coverage. And then there's also another alternative called MediShare, which is what I have. But what that is not even insurance. It's a complete alternative, no pre-existing conditions, and it's not insurance. And that fits a certain demographic of people. So you got to prepare yourself. Get all these extra carriers. Be ready. If you're wondering, well, Luis, I don't have any of those extra carriers. I need help. Send me an email. Down below, if you click on the More button, you will see my email. Send me an email. I will be glad to help you out with contracting. Okay. I still think, even though there's some doom and gloom for ACA, I still think ACA is a great product. Yes, it's going to be harder. We're probably not going to make as much money as we have in the past, but it will get better eventually with the next administration. Or maybe with this one, there'll be some changes. Either way, there's still nowhere else for people to go to get medical insurance. Okay, it's not like there's a third, fourth, or fifth alternative. It's either they get insurance at work through their employer if it's available, they get an ACA plan, okay, or they go with an alternative that may not cover any pre-existing conditions. So if they've got something wrong with them, they're going to have no choice. They're going to just have to get it. So you just got to be prepared to help them find a plan that fits their budget and still works with them. Guys, I hope this helps you out. Don't forget down below, send me an email if you need contracting. Also, I've got my ACA Smart Book. I've got my Medicare Smart Book. I've got an ACA 101 course. I've got Agent CRM. I've just developed all of my workflows, a 2.0 version of all my workflows for ACA, Medicare, life and dental, P&C if you do P&C, and life insurance. I don't know if I said it or not. I've got all those workflows that you get when you use my affiliate link. And then finally, I will finish off with a social media course. I get a lot of agents asking me, Luis, where do you go get leads from? And I'm not out drumming the streets like I used to. I advertise on social media. I partnered up with Shauna. She has a great program that teaches you how to advertise on Facebook and Instagram. So if you have no idea how to do that, guys, hop on that course. I've got the link down below. Take advantage of it. We're just going to have to get out there and hustle just a little bit more than what we've done in the past. Still going to be a great thing. Don't forget to comment, like, and subscribe. This is Luis Moreno with Insurance Agent Training.